Hi everyone, welcome back to Feeding Ravendoodles, a pet parent's guide to nutrition. Today's topic is therapeutic diets. Now, certain pet health conditions or chronic diseases can actually be managed through a diet. Isn't that amazing? So, therapeutic diets are special diets that act like medicine for your pet. And they've been developed over decades by scientists, board-certified veterinary nutritionists, and other experts in the industry. Today, we are going to be talking all about therapeutic diets and how they work, and a little bit about examples of different types, and then some alternatives to therapeutic diets as well. You're going to have to bear with me also today because Raven has decided that she doesn't want to cooperate with me, so she'll probably be all over the place. So you'll just have to excuse her. So therapeutic diets are pet foods that are designed to be fed as the sole diet for pets who have chronic health conditions or diseases. Therapeutic diets are designed to act similarly or complementary to medications, so therefore they're used to treat or prevent specific diseases. Like I said, these diets have been developed over decades by veterinarians, veterinary nutritionists, and other scientists, and an immense amount of research has gone into formulating and creating these diets. Therapeutic diets have also been proven through research and feeding trials to prevent, treat, or cure specific pet diseases. Therapeutic diets fall under the FDA's definition of a drug, which is a substance intended for use in the diagnosis, cure, mitigation, treatment, or prevention of a disease. So although therapeutic diets do not contain medication, they are actually considered drugs in that their purpose is to treat or cure or prevent a disease. So therefore, the FDA is going to regulate the production, labeling, and distribution of these products. And one of the many requirements that the FDA has for therapeutic diets is that they must be made available to the public only through a licensed veterinarian. You should see this type of specific terminology on a true FDA-approved therapeutic diet. Some pet foods that are available over the counter or not just based on prescription through the veterinarian do contain claims that they can treat or prevent disease. And these diets are what the FDA calls misbranded. So they are mislabeled and they are not FDA approved. So unless they include a disclaimer like one of the ones shown here on their label, the pet food companies who produce these foods can be subject to legal action by the FDA. But unfortunately, it is very difficult for the FDA to enforce labeling just due to the sheer number of pet foods and pet food companies out there. And because of this, they rely heavily on reporting. You're also going to want to be wary of vet-approved or veterinary diets that are available to you without a prescription from your veterinarian, so over the counter. So here are some examples of what you might see on pet food labels that are not representative of true therapeutic diets. So these diets are not regulated by the FDA unless they include that specific terminology I showed you earlier, and they are not approved to treat or prevent any disease, despite any claims that they make on the label. You're also going to want to be wary of therapeutic diets or veterinary exclusive diets that are made by companies outside of the United States. So these companies don't have to adhere to the FDA's policies, and therefore they're not the same quality as diets that are developed and manufactured here in the United States. There are actually very few companies that have the expertise, facilities, and funding to produce therapeutic diets. These companies are going to employ board-certified veterinary nutritionists, perform scientific research and feeding trials, and uphold stringent quality control. These pet food companies are also registered as drug manufacturers with the FDA and therefore are regulated by the administration as well. The therapeutic diets that they produce must be proven to be effective for the treatment or prevention of a specific disease. And so all of these factors definitely add up into the expense of the diet. So it does cost a lot to employ experts, develop the diet, and meet all the FDA's regulations. And for some more information about finding a reliable pet food manufacturer, check out my video, How to Pick a Pet Food Part 1. There are many different therapeutic diets out there. Each one is used to treat or prevent one or more specific diseases in dogs or cats. These diets can include, for some examples, renal diets that treat kidney disease, urolith diets that treat and prevent bladder stones, obesity diets which help dogs and cats lose weight, thyroid diets which help cats with hyperthyroidism, hypoallergenic diets which have hydrolyzed proteins for pets with food allergies, joint diets which help control arthritis pain in dogs, gastrointestinal diets which help alleviate signs associated with digestive disease in dogs and cats, recovery diets which help dogs and cats in a critical care or emergency setting in the veterinary hospital, diabetic management diets, so a diet that actually helps treat diabetes in dogs and cats, and there are several others. So if your pet has one of those health conditions, your pet's usual veterinarian should be able to diagnose their health condition and provide you with a prescription for a therapeutic diet that meets all of their needs. If your pet has been prescribed with a therapeutic diet, great. You're going to want to make sure that you follow all of your pet's veterinarian's instructions for feeding and medicating your pet. So some pets do still need medications even when they are on a therapeutic diet, while others might not. Sometimes a therapeutic diet might need to be fed exclusively. So this means that they can't get over-the-counter treats, people food, flavored medications, or other things like that because it could mess up their metabolism or other things that can interfere with the therapeutic diet. Some therapeutic diets are also unsafe for normal healthy pets. So because of this, you're definitely going to want to keep your pets separate during feeding times. You'll definitely want to ask your pet's usual veterinarian what they recommend regarding all of the things that I just mentioned. And of course, you're going to need to bring your pet to the veterinarian regularly for checkups and renewing their prescription for their therapeutic diet. So we're going to talk about a couple of alternatives to therapeutic diets, some of which are generally safe and some of which are generally unsafe. The first alternative that I have is medication. So oftentimes a therapeutic diet is chosen to help avoid or reduce the use of medication in the treatment of a disease, but many chronic conditions do still require medications in conjunction with that diet. So if a therapeutic diet is not an option for you, medications may still be an effective alternative. So, and this is on a case-by-case basis, so it's going to vary based on the pet. So your pet's usual veterinarian will be able to advise you on the best course of action for your specific pet. Many pet parents choose to go the homemade route when their pet has very strict and specific dietary needs. Oftentimes, this is especially true with pets who have multiple health conditions, and there's really no commercial diet that can fit their needs. If you do choose to go the homemade route, you're definitely going to need to work with a board-certified veterinary nutritionist because they are the only experts qualified to formulate a therapeutic diet for your pet. And if you're looking for more information about homemade, check out my video, Homemade Diets. Dietary supplements are not regulated by the FDA or AAFCO. Attempting to balance or alter your pet's diet with supplements without the assistance of a board-certified veterinary nutritionist can be detrimental to your pet's health, especially when they have a chronic health condition. Dietary supplements are also not proven to treat or cure any disease, and therefore should never be used to manage a health condition on their own. However, there are some supplements that may contain nutrients, like omega-3 fatty acids, for example, that might help the body fight or recover from disease. But before you buy any supplements or dietary additives, you're going to need to discuss it with your pet's usual veterinarian, because there are many supplements out there that can harm your pet's health, especially when they have a chronic condition. And there are many, many more that will not help them at all, and you'll probably just be wasting your money. Raw meat-based diets are not safe for pets with health conditions. They contain bacteria and parasites that can cause severe illness in immunocompromised patients. Due to their uncooked nature and their nutrient profile, they can often cause digestive upset, and because of this pathogenic bacteria that they harbor, they can often make disease processes much worse. So never ever feed raw products to pets with medical conditions. For a lot more information on raw products, please check out my video, Raw Diets. Thank you so much for watching this Popular Topics video on therapeutic diets. Don't forget to like, subscribe, and share this video with your friends. And leave any comments down below if you have any questions or suggestions for future videos. Also, check out that video's description below where I give you a bunch of resources that I used to create this video. And don't forget to check out feedingravendoodles.com, where I have my complete collection of articles, videos, and resources all in one place for you. Next time, we're going to be talking about dietary supplements. Say bye, Raven.